Hello everyone, welcome to my channel Haemodialysis Simplified. In these small sessions, we will be discussing on various aspects of hemodialysis. This particular session, session 4, we are going to discuss about AV graft. I just suggest you to check with your sender protocol before you change your protocols after this session. You may follow your sender protocol accordingly and check with your concerned authorities before changing any protocol. So if you look in general, this is the AV fistula, probably the best possible vascular access, which does not include any external body. A patient's own artery and vein is anastomosed over here, and after the anastomosis or the surgery or fistula creation, the arterial flow is diverted over the vein as you see here, and once normally about 4 to 6 weeks, this vein become more visible and ready to needle. So this is probably the best option in terms of vascular access, and AV fistula is considered to be less troublesome, and it lasts for several years if maintained properly. So in case this is not possible, then other access option to be exercised. Like over here, if you see the comparison between AV fistula and AV graft, this is an AV fistula, and here you will see an AV graft, which is straight one, extending from the radial artery to cubital vein. And again here, this is a curved graft or loop, which is extended between brachial artery and cubital vein. So this is a short U-shaped or rounded structure which is placed over the artery and vein. So this is the best option after AV fistula, whereas AV fistula is considered to be the best one. Other option, as you are aware that there are temporary catheters and the so-called permanent catheters called internal jugular or subclavian or perm cath. All are central venous catheters. Sometimes this will be placed on internal jugular, sometime on subclavian, sometime with a tunnel as a permanent catheter. Sometimes this will be placed on the femoral vein as well in case the patient require immediate dialysis. So this is a temporary access, may last for a few weeks or few months. Probably the permanent catheter may be used for about a couple of years if provided with extreme care in terms of infection control. So let's see why or who is for AV graft. Some patients having very small vessels which are unsuitable for creating an AV fistula, those patients can go for AV graft. And sometimes an exhausted AV fistula or a failed AV fistula, then they need to go for a graft in case the other they require a little longer term dialysis. And sometimes it is quite country specific. Some countries prefer AV graft over AV fistula. This is again a country specific aspect. However, if you see the advantage of AV graft, unlike fistula, we need not wait for 4 to 6 weeks after creation of AV fistula for maturation. This graft may be used within 2 to 4 weeks after the surgery. And this can be done on an outpatient basis with local anesthesia, and patient can get discharged in the same day, or it can be done on the local anesthesia. So again, if you look at the materials, what is the material used for AV graft? This is an AV graft. You can see here this is placed subcutaneously. Whereas the material used for material used for AV graft is called polytetrafluoroethylene or PTFE materials. This is an extremely soft and biocompatible material which will be almost like a blood vessels, and this will be placed under subcutaneous way. Then the needling, once it matured after 2 to 4 weeks, once the surgery is completed and the wound is healed, this can be used actually. So this is the material. In extreme situation, the advanced situation, there is some other material called Dacron fabrics or expanded Teflon, which is as almost like this mimic like a blood vessel, but this is supposed to be very expensive. So the most prominent material, most available material is PTFE or polytetrafluoroethylene material, which is used for the prosthetic graft. So this is quite common because it's cheaper, and again the longevity is as good as ePTFE. One thing we need to understand on graft is if we needle in a wrong way, meaning where we are supposed to needle artery, if we needle a vein and in the vein place we needle an artery, then there will be tremendous increase of venous pressure that results in very high backflow and recirculation. If you see this diagram, if you see here, this is the blood, which is the needle where the blood is going out. After the circulation, it's coming back to the vessel, and part of the blood will again flow back through the arterial needle. So this is the recirculation. So this is a little more compared to AV fistula in graft, where this can be minimized by selecting the right way where to needle an artery and where to needle a vein in terms of fistula needle or cannulation. So this is very important because if you wrongly needle, the recirculation can go many-fold and patient may not get adequate dialysis. So if a patient comes to you without any record of surgery, how it is constructed and how it is made, then you cannot take a grand rule like towards a patient is the vein and away from the patient is artery or vice versa. So there are very simple techniques to analyze or understand where can we needle for A and where can we needle for V. So once you understand that, the recirculation can be minimized to the larger extent. So let's see how this can be assessed. So it's very simple. These are the 4 different methods of graft creation. It's a straight one from here to here. Another one is a curved one extended from here to here. And another one is here to here, again a straight and curved. So we cannot take it for granted this side is artery or this side is the vein, because it may be in the other way also. So if you needle wrongly, a place supposed to be the artery, if you needle a venous needle, the venous pressure go very high, and that can create exorbitant amount of recirculation and patient land up in poor dialysis. So how do we uh, guess, or how do we analyze, or how do we understand where to needle A and where to needle the so-called V? So it's very simple. What we need to do is just press in the middle of this graft like this. Use your index finger or thumb here or here or here or here. So apply a little bit of pressure, then take a stethoscope bell, auscultate here, auscultate here, auscultate here, auscultate here, auscultate this area and auscultate here. Again, you can auscultate here and see over here. So where you get a greater bruit or a large sound, or you get a churning sound higher, that portion is considered to be the artery. So when you needle, we need to needle that place as artery and the other place as the vein. So where you will have lesser recirculation and patient get a better dialysis. So if this is the construction is right, if you apply a pressure here and if you check with the stethoscope over here, this area will get lesser sound, this area will get higher sound. So one needle can be needled toward this, that can be taken as artery, and one over here can be taken as vein. So this is the general basic assessment of understanding where we can needle A and where we can needle B. So that will avoid recirculation. Same over here. You can apply your medium pressure over here and auscultate here. You will get greater bruit here and lesser here. So this needle can be an A and this can be a V needle. So same is the case in both these construction of AV graft. So this is a very simple method. This can be done on the bedside. You need not do any equipment. You can just use a stethoscope and assess the flow geometry. So accordingly you can needle the patient. So this is the one which an expansion of this, and you see here the venous needle. Here this is the area where you get a lesser bruit, and here you get a more bruit. So he can needle over here for artery and needle here for vein. So this is the general rule applies. So the general care, as I've explained in my earlier videos, the general care by patient, the fistula need to be cleaned every day with soap and water, simple cleaning. Do not use any scrubber because the scrubber can create small crevices or rashes, or it can create a little bit scratch mark over the surgery area, or sometimes it can damage the AV graft. So just use washing just by using soap and water. Again, you should not allow the people to check blood pressure on the AV graft hand, and not to wear very tight clothing on the graft hand, and not to carry very heavy stuff over the graft hand. This is a common rule which I explained in my earlier video as well. And in case a patient get admitted suddenly because of some reason in some other hospital other than their respective dialysis center, or the center they do not have any idea about dialysis, we should not allow them to put cannulas over the graft hand, or not to connect any IV line, or not to collect the blood samples from the graft hand. And again, not to scratch over the hand vigorously. This again can create a little abrasion and infection later on. So another basic care is patient need to check the AV graft every day, whether there is a thrill or bruit over there. This can be done by the patient at home every day, just like a small ritual. Before cannulation, we need to do a good counseling to the patient, explain them why we are doing this, whether what is the pain possibilities, and how do they needle, and what care need to be taken care after the removal of needle. All these need to be explained to the patient before cannulation. And before the cannulation, once they arrive into the dialysis center, it is always better to encourage them for washing the hand, because they must be traveling outside. There will be a lot of dust and heat or sweat or on the street cloth. So it's better to wash in the dialysis unit with simple soap and washer. Do not use scrubber. Again, as I said earlier, these cannulations are basically a clean hand procedure. Both caregiver and patient need to clean their hand before the procedure. In case some patients are very sensitive to pain, we may give a little bit of local anesthesia, either injectable or as a cream. So this is a patient choice. So again, needling technique is very important. We can see that not to puncture on the same site again and again, because this forms a lot of scars on the graft material, and sometimes this can damage on long term. Most importantly, it is always better not to apply tourniquet. After the dialysis is over, once the blood stops, apply a simple plaster on the puncture area once the blood stops, and it's always to be done on semicircular way, not to wind around the hand. So these are the basic care need to be taken care in case of graft. And post-dialysis care need to be explained to the patient when to remove the plaster, how to handle it, whether exercise need to be done or not after the day of dialysis after removal of needle. Normally, it's recommended not to do any exercise or not to lift or not to disturb the hand much. So this need to be explained to the patients. Post removal needle care is very, very important. So that's all from me for this time. Thank you for watching, and look forward to see you with another video soon. Thank you very much.